All right, firstly, I just want to say good day to you all and a big thanks for joining us. On behalf of myself, my name's Peter Bateman and my partner Derek Ross from Dell Financial Services. We'd just like to extend a warm welcome to all our clients on this very first webinar that we're doing a live broadcast to our entire base. It's a first for me, and I think it's the way things are going nowadays. Personally, I prefer to do things in the flesh, but hopefully in a couple of months' time, we'll get back to that. Our primary goal here at Dell is to give our clients best advice and keep them at all times up to date and informed with all relevant topics and issues to do with healthcare. Today, we're very proud to acquire the services of Dr. Nolantando Nemetswarani. I hope I pronounced that right. I'm going to refer to her as Dr. Nolo. She is a very highly respected individual who heads up the Center for Clinical Excellence at Discovery Health. She'll be with us today to share her wealth of knowledge with us on the subject that's very hot on everyone's lips and has been for the last 18 months, that is COVID-19. But more specifically, she's going to chat on the issues of vaccines, their relevance, their credibility, as well as dispelling and giving more clarity on the many myths that are associated with people getting the vaccine today. Just to let you know, we're going to be recording the session. So for all our group clients, the HRs we'll send out the link tomorrow or the next day, and you can send this to all your employees that don't get to see this live. And also, before I hand over to Dr. Nolo, we also have at the bottom of your screens, there'll be a little questions and answer tab where you can ask any questions via text, and hopefully, well, I'm pretty sure Dr. Nolo will be able to answer them at the end of the session. Also, a big thank you to Tando Mahlambe. She's been fantastic. She's been coordinating this whole webinar. So Tando, a big thanks to you. All right, so if I can hand over to Dr. Nolo, and she'll be presenting to you for the next 30 to 40 minutes.
Thank you so much, Peter. Let me try and get my slides up. Okay. They should be showing now.
Yes, they're showing now. That's all.
Perfect. Okay, I'll start right at the beginning. Thank you so much for inviting me today. I'm so sorry, I'm in an environment where there may be slight noise, but I'm hoping that for most of the presentation, you will be able to hear me very well. So today, I'm just going to give you a high-level overview of some of the points that are important when we have a discussion around vaccines. But most of the discussion around the clinical aspects of the vaccines, I'd like us to have a much more interactive session with the audience so that we can answer most of the questions as best as we can. So just understanding firstly COVID and its progression. So we know that majority of people with COVID will present with mild illness, and some may start with mild illness, which after some time, it progresses to much more severe illness, requiring hospitalization and for some requiring ICU admission. And what we see usually in the early stages, you know, where we talk about the host immune responses, this is really, you know, in the first 7 days of the infection where people usually have, you know, runny nose, blocked nose, headaches, muscle aches. And after that, you know, the condition may progress and complicate into a pneumonia. That's when people start having shortness of breath, unable to breathe. And as a result of that, then, you know, they may be admitted depending on the oxygen levels in their body. But some people get to what, I mean, there are technical terms, but people get into a position of hyperimmune response where then they complicate, and usually if they are not responsive to treatment may die from COVID complications. So I thought it was important for us to just maybe give a high level overview of how COVID works. And right now, you know, we only have a few drug classes that are used in the treatment of COVID. And one of those drug classes being the steroids that are usually given to patients who are in the hyperinflammatory phase. There are some other drugs that have been approved for use in this space. But we do know that, you know, the drug therapies for COVID right now may not always work for everyone. While they may save lives, we know that they may not work for everyone, which is why I think when we have a discussion around vaccinations, it must be in the context of understanding the progression of disease of COVID and the fact that with the current therapeutics, we may not always be able to save lives. And therefore, we do need all the various interventions, include the preventative measures for severe illness with vaccinations. And we know that as much as COVID has been thought of as a respiratory illness, we also know that it may affect almost all organs of the body. As you may know that, well, the big part of COVID is really respiratory, which is the lung space where people present with pneumonia. But we know that once people get into severe forms of COVID, it can affect the heart, it can affect other organs like the liver, the gastrointestinal tract, which is your gut. It may, result in some nerve-related complications. So I think it's important to understand this, because when we think about COVID, people may have the acute illness, they may be sick, but we know that some people, even after we consider them to be recovered, they may have persisting symptoms, which we consider to be long COVID. I think most people have heard about long COVID, and people who are suffering from these persisting symptoms beyond that 3 weeks or the 1 month of acute infection, we usually call them long haulers, or people who are suffering from long COVID. I think it's important to understand this, because then we have got a better understanding that COVID-19 is no longer just a respiratory illness. It is a multi-system disease. So just understanding what is happening currently with the infections, I think we saw a huge wave in Gauteng, third wave. And I mean, we've seen numbers that we've never seen before in Gauteng. As you can see in the previous waves, Gauteng had, very manageable, cases. And I think what we saw in the third wave was really the worst we have seen. And I mean, it resulted in people struggling to get, beds in hospital. So I think it's important to understand that, this is what happened. As the infections are coming down, please, we must also be aware that infections continue. Yes, the numbers may be coming down, but people are still getting infected, because every day we still are getting reports. And what we're seeing, are infections going up in the Western Cape, in KZN. Our total daily infections are still sitting over 10,000, reported in the previous days. So I think, we can't be complacent. We need to be thinking about all interventions to prevent severe illness and death. And from our side, from a discovery point of view, we are seeing a reduction in admission significantly after peaking at wave 2 levels, and we were seeing significant pressure on ICU beds in Gauteng during the third wave. So I think it's important for us to just understand. So these are some of the admissions that we saw and cases admitted, and also people who end up in ventilators and in ICU. This is just high-level stats. And with the modeling, we can see that there may be potential waves coming through. And I think we're at the start of COVID, we didn't expect variants. We thought, if we manage this and we contain the infections, we can get head-to-head immunity quickly. But I think COVID has taught us that, if we do not be aggressive in terms of how we manage, we could see ourselves sitting with new waves in the future. And hopefully, as time goes on, we may exit this pandemic, or we can think about COVID as existing, within the communities, what we call endemic, but no longer causing such severe illness and death. And there are certain interventions, therefore, that are required for us to reach that. So if you think about the total deaths at the end of the third wave, expected at 210,000 COVID deaths. This is looking at excess deaths as reported by the South African Medical Research Council. So if you think about the medium scenario of total deaths expected, it could go up to 241, or it could be in the worst case scenario 308 if we do not vaccinate. So if we think about vaccination, therefore, if we're thinking about future waves, we're thinking about a 65%, if we vaccinate 65% of the population, we could save at least 67,000 lives of the estimated deaths in the future if we were to not vaccinate. So we know that vaccines have largely nullified the impact of several severe viral illnesses in the past. I mean, some of us, we grew up not knowing about smallpox, diphtheria, we just know because it is part of our studies at med school. Pertussis, yes, we've seen some cases of pertussis, and usually when we see some outbreaks, it's usually in unvaccinated kids. Measles outbreaks, it's usually, from unvaccinated kids. But I think about conditions like polio, where we vaccinate our kids at an early age. We have almost eradicated polio through vaccinations. I've got a brother who had polio, over 40 years ago. And, unfortunately for him at that time, there were no vaccinations. But I think when people think about polio, they don't even know that it's a disease that ever existed. So I think when we think about vaccinations and their role in infection control, we must always reference what we know. And we know, I mean, with Haemophilus influenza, we've been, also vaccinating young children. And then there is obviously influenza vaccines that we offer on an annual basis, specifically to people with comorbid conditions. So this is just to remind ourselves that there used to be some of these infections before, which we have eradicated with vaccinations. So when we think about some of the vaccine efficacy data that is emanating from South Africa, we already are seeing, some reduction in infections, in hospitalizations, and in deaths. And this is also something that, when we look at our excess death data, we are already starting to see in the older age groups, the over 60s, we're starting to see a reduction in excess deaths. So these are still preliminary, but promising results that show that if we are to go down this path, we are expecting very positive outcomes for the broader population. And I think, there are various other case studies that we can reference globally. If we look at this, data from the US, looking at various states and looking at hospitalized patients and the number of cases, and looking at, obviously, at the vaccine uptake in those various states, as you can see, the higher the vaccination uptake, the lower the number of cases and hospitalized patients. Other, global environments that we can reference is the UK and thinking about Sydney also in Australia. So just here we are, referencing the Australian, data, looking at the reduction in new infections, admissions, and deaths. But I think as I'm maybe, looking at this particular data, it's important to almost explain that with the current vaccines, we are not, I think the main aim of vaccination remains reduction in, severe illness and death, meaning that we minimize, the forms of severe COVID that we have seen that have resulted in hospitalizations and death. But it means that people can still get infected. But what we are seeing in the data is that the number of breakthrough infections, which are infections happening in people who are fully vaccinated, are still much, much lower than what you would see if people were unvaccinated. So while we can still get infected even when we are fully vaccinated, the number of those breakthrough infections are very, very low. I think in some of the reports, I mean, the most will be around 2% in the vaccinated population. So it means that even though you can still get infected, there is that, there's a lower chance of you getting infected, which obviously then reduces the number of circulating cases within the community, which may eventually then result in COVID-19 no longer being an issue in our communities. And I think it's important to understand that, COVID in pregnant women has been associated, firstly, not only with maternal, mothers dying and getting hospitalized from severe illness because of COVID, but also the pregnancy outcomes of preterm birth and low birth weights in those mothers who have contracted COVID while pregnant. So with recommendation for pregnant women to be vaccinated, we are already seeing some preliminary data around a reduction in some of these preterm births and low birth weight babies. And I think we must understand that preterm delivery has got its own complications in the child. Some of the kids may actually have brain-related effects from preterm birth. So it's as much as it can just be viewed, okay, the baby was born early. It does come with some complications that may be long lasting for the baby. So maybe just on this slide, I think in the early days of COVID, we thought that COVID actually spared pregnant women. But later on, as data became available, we then realized that actually COVID affected pregnant women in a much more severe form, resulting in these hospitalizations, which is severe illness, and for some of them ending up in high care, ICU, and for some of these pregnant women dying. I mean, we've seen young cases of pregnant women in their early 30s dying from COVID with no other pre-existing chronic conditions. So when we have had engagements with the obstetricians around this, they have said for these women, the best intervention is vaccination. In the South African context, currently the recommendation is that all pregnant women who have completed their 14 weeks gestation, meaning that they've completed their 3 months of pregnancy, they can be offered a vaccine, and there is no preference for any of the vaccines, so they can either get the Pfizer vaccine or the J&J vaccine. And I think this data then confirms, some of the positive outcomes that are associated with vaccination. So what are some of the vaccine myths that we are hearing about? People are saying the COVID vaccine will infect me with COVID virus and I can infect others. So just maybe to start with that first myth, if you think about how vaccines work, we introduce some parts of the virus or the full virus, but inactivated into your body, meaning that any part that is introduced to your body is not a live virus, meaning that it will not make you sick. So I think that's the most important aspect of vaccination that needs to be understood. And this is a concept that is not new, and it is not only coming with COVID. It is the concept that has been there in developing vaccines for many, many decades before COVID ever became something that we are now dealing with. So it means when you are vaccinated with the COVID vaccine, you are not getting a live component of the virus, and therefore you cannot be, infected with that. The side effects that we get are really as a result of our immune response to the vaccine. So it's an important response because we are training our immune system to be able to identify COVID once we get the real infection in future. And then they say the COVID-19 vaccines can alter my DNA. This is another important aspect that we need to address today, because if you think of the mRNA vaccines, these are vaccines that use the messenger RNA. So now we'll have to go to Biology 101, where we must understand the role of the messenger RNA. It instructs our cells, and usually the components that it is instructing us sitting in the cytoplasm of the cell. So it's difficult to explain this in lay terms, but it never gets to the core, which is the nucleus of your cells, where your actual DNA is sitting. So it is important for people to understand that there is no way that the vaccine can change, your genetic composition and make you someone different. So I think it's understanding that when you understand the biology and you understand where the vaccines actually work, they are unable to actually do that. And then they say, there's a magnet, COVID includes a tracking device. All of these are untrue. I mean, people have used the social media platforms to peddle this misinformation, either to cause fear or to perpetuate, some particular agenda around anti-vaccinations. And they say the COVID-19 vaccines were also developed so quickly. It's understanding that vaccine technology has been there, before. So vaccine technology is not new, but what we have done is really to leverage those technologies so that we can fast track the development of COVID vaccines. And the other important thing is that because we are sitting with a public health emergency, meaning that we do not have time to be trying to think about, oh, it's going to take 10 years before. By that time, we would have lost so many people from COVID if we wait until, we do processes that don't necessarily help in a public health emergency. So if we think about, for example, the emergency use authorization under which these vaccines have been, approved for use in individuals who, like all of us, it's really about doing everything that needs to be done from a clinical trials point of view. So what happens is that vaccines are tested first in the lab. So they will check and say, okay, it works in the lab, and then they test it in animals and they see, oh, it works in animals. And then they test it in healthy individuals in small numbers to test what is the appropriate dose to give. And then after that, they say, we've given it to healthy people. This dose seems to work and it seems to be safe. And then they, expand, the use into hundreds of people, where now they start checking whether, it does what it's supposed to do and how well it does it. And then following phase 2 trials, so we say phase 1, which is healthy people, phase 2, hundreds of people, and then phase 3 are the biggest trials, multi-center trials. And in the COVID vaccine scenario, we had thousands of people volunteering to participate in these trials, including our own South Africans who participated in these trials. And what the phase 3 trials give us is information about the safety of the vaccines, about the efficacy, meaning that when people are vaccinated, you compare to people who are unvaccinated, you understand the side effect that people who are vaccinated get. You also understand how their bodies respond in terms of fighting the infection and looking at whether they get hospitalized or whether they die. So that all that process was followed with the COVID vaccines. The only difference is that while we were testing these in clinical trials, the manufacturers were already preparing for production of these vaccines so that there is no delay in getting the vaccines to people. So I think it's understanding that there was existing information and research that was there before COVID for other vaccines that was used to fast track COVID vaccines, and also the fact that no shortcuts were taken in the testing in clinical trials. And then they say everyone who gets this vaccine is going to die, and everyone is going to get a blood clot, and all of us are going to die in 2 years. There's all that misinformation out there. Please do understand that in South Africa, we've got 2 vaccines right now that are part of the rollout program. The Pfizer vaccine, which is a 2-dose vaccine. This vaccine is given 42 days. So there's an interval of 42 days between the first dose and the second dose. The Pfizer vaccine, you get fully vaccinated after 2 weeks of your second dose. And the second vaccine that we have is the J&J vaccine, which is a single dose. You only get 1 shot with the J&J vaccine, and you are considered fully vaccinated after 28 days. So looking at the 2 vaccines, the side effect profile of these 2 vaccines is similar in terms of the mild symptoms that you may get, like headaches, you get muscle aches, muscle weakness, you get fatigue, you get fever, you get chills. So those are the common side effects across the various, across the 2. But with J&J specifically, there are other rare side effects that have been documented in a few people in a million. So if we think about the blood clots that were seen, they could affect, the vessels of the brain, of the chest, of the abdomen, which is your tummy, and also of your legs, where you can get these small clots. These side effects are very rare. They were, identified in about 5 in a million people who had received the J&J vaccine. So this is well reported and well documented. And we warn people that normally when you get the vaccine, we expect you to have side effects within the first 2 to 3 days after you've received the vaccine. If you start getting severe headaches, severe abdominal pains, severe abdominal pains, severe leg pains, then in those instances, you do need to consult because you could be having one of these rare side effects. The other side effect that has been reported recently with the J&J vaccine is that of this progressive muscle weakness, which is called Guillain-Barré syndrome. Even there, very, very rare side effect, but when people start experiencing that, which is also we encourage people to get these reported, so that we can know about them, and also, people can also get help quickly so that, their side effects can be managed. So these side effects for now can easily be managed and people can still survive. And then with the Pfizer vaccine, one of the common side effects, one of the rare side effects that are linked to the Pfizer vaccine is, allergic reactions, which have been reported up to 11, cases in 1 million doses that are provided of Pfizer. So for people who have got pre-existing allergic, conditions, we encourage them to disclose these when they go to get vaccinated, so that when they get vaccinated, they are monitored for a longer period than normal people. Usually we monitor people for 15 minutes after they've received their vaccine. For these people who have got severe allergic, a history of severe allergic reactions to other, medications, we then we will then monitor these people for at least 30 minutes. So I think that is important. And then the other side effect that has been recorded, specifically in younger people, adolescents elsewhere in the world, is, heart muscle inflammation, which is called myocarditis, but also very rare. So I think it's important to understand that while these severe side effects, which are still, they can still be managed, while they are rare, it is important for us to still make sure that people are aware of this. So when we take the public health view, which is saying, looking at the overall benefit of the vaccines, considering some of the rare side effects, then we are comfortable that the vaccines are relatively safe for use by many people, even though a minority of people may still get these rare side effects. And then someone say, I already had COVID-19 and I've recovered, so I don't need to get vaccinated when it's available. So we do understand that, when you do get a COVID-19 infection, your immune system obviously builds up a response. And because of that fighting mechanism that your body will go into once you get the infection. We still encourage people to get vaccinated because we know that the natural immunity, meaning that the immunity following the infection itself, may wane over time, meaning that you may not be properly protected over time. And also with the emergence of the variants, we don't know how well your natural immunity, because you may have been exposed to a different variant, whereas vaccines, the way they are developed, you find that they've got a broader spectrum of cover in terms of protection. While we do know that some of the variants may have reduced efficacy from the vaccines, but overall we do see broader coverage from these vaccines. So I think it's important for us to think about how we increase vaccination uptake, access to vaccination, making them available to our employees, promotion of vaccination, communicating and promoting vaccines. But I think for me it's important to be transparent about the information, speak about the side effects that we know about, give people information when people are doubtful about certain things that they see on social media, for us to be there to say, this is what we know from the literature. I mean, one of the myths that I've not touched on is about infertility, where people are saying, these vaccines make us infertile. We've got data that shows that there is no such, there's no truth in some of those, utterances. So it's important for people to be provided with that information that allows them to make informed decisions. And I think for us, the other important thing is really about how we role model to our colleagues, to our families around vaccinations. And in some companies there is a consideration for mandatory vaccination policies, and there are also views around how do we incentivize vaccinations so that people can come forward and get vaccinated for the benefit of the broader population, and also for individual benefit as well. Because I think in some of the surveys that have been done, I think most people vaccinate really to protect themselves rather than to think about the broader population. But if the broader population in the long term also benefit, I think then it becomes a good thing from a public health point of view. So I think we do need to then just think about some of the implications of COVID and how vaccines also come in. I think this is a broader concept around thinking about long COVID, because it affects various aspects of your body, and some people can have persisting symptoms. What we have seen is that vaccines for people who have persisting symptoms have been shown to actually improve some of those symptoms, even though it does not improve for everyone, but it's a significant percentage of about 57% of people who received vaccinations who are sitting with long COVID, had an improvement in their symptoms. So if we think about long COVID and the impact on productivity, it's important for us to be on the lookout for it, be aware of it, and understand what can be done. Some of it is really about screening and understanding who has long COVID, recognizing the significant physical and mental impact. We know that a lot of people who have had COVID and end up experiencing long COVID have got anxiety, depression symptoms relating to that. And I think it's important to think about how we provide appropriate health and recovery support, including the incorporation of vaccinations in that, and watching out for these long-term sequelae for those people who may not respond that well. I won't touch much on the hybrid work, but it just talks about the overall impact and how obviously we could think about vaccination as also a way that we could be thinking about returning to the office. So I think on that note, I'm going to maybe just share some of the slides. Sorry, let me see if, just looking at the vaccination program in South Africa, I think right now we are sitting at, we've opened up to the 18 plus, and we are encouraged by their enthusiasm in terms of taking up the vaccines. And our data is already showing obviously relative COVID reduction, reduction in COVID infections and relative reduction in COVID admissions as well. So I think this is very important, to start showing some of this preliminary data as well. So this is some of the J&J data, that I'm sharing with you here. Looking at some of the efficacy against infections and also against admissions, understanding that you are fully vaccinated once you have reached once you have at least completed your 28 days. Another important point that I have not mentioned during the presentation here is that for the immune system to start kicking in, it takes at least 2 weeks. So we know there are certain people who might have received their first dose and then they get sick. What people have almost associated that with, they would say it is as a result of the vaccine. And most of the people that have actually become sick are people who went to the vaccination unknowing that they already are infected, and then they got sick, a few days after, their dose of vaccination, whether it's their first or second dose. And if it is a J&J, their single dose. And also, we've also seen people, who get infected immediately after they've been vaccinated, meaning that those people were not fully protected because their immune response had not kicked in to a level where, they would have received adequate protection. And for those people, they would still then be sick. and some people have actually died because they were not protected from COVID at that point. So I think for now, I've tried to cover as much as I can in terms of the slides. I think now we can maybe have some of the Q&A where we can take questions and address them as we move along. Starting with the first question that says, if I had cold or flu, should I get vaccinated, or is it advisable that I heal from the cold and then get vaccinated? So I think when we have such high numbers of COVID, it's circulating in our environment, we usually say, please exclude COVID first, because most people may think I just have a common cold, but it may be that you have got COVID. So the most important thing is to get, COVID excluded. And if COVID is excluded, then we can, if you've got mild illness, you can still vaccinate. But if you are running a fever, then we do not encourage you to get vaccinated. And then someone is saying, what about reports that the COVID vaccine kills off any other antibodies? So there is no way that you kill off any other antibodies. Remember how our body works. So we get exposed to various infections. If you think about how we have survived for all our lives, we are exposed to a lot of bugs that are circulating in our environment. And our systems are used to then, developing the fighting and developing memory cells against that specific bug. So if you have developed immunity against flu, you've got the memory cells against flu. If you've got immunity against any other virus or any other infection, I mean, if you think about children who have been immunized, they get immunized across a wide range of infections. And it's not like once now you give one vaccine, the protection against the other infections is gone or is lost. So I think it's important to understand that there is still protection because it's very specific to that particular molecule, infection or virus that we're talking about. Is there any indication as to when the rollout for below 18s? So right now, we are not aware of when that will be. But obviously, I think we want the over 18s to vaccinate. And I think if we're thinking about people with chronic conditions, people who are older than 60, even though, yes, we've got a significant number who have vaccinated, I think the vulnerable groups need to be prioritized and vaccinated first, because that's where the highest number of people who are dying is sitting. If you think about the younger than 18, the numbers are very small in terms of severe illness and death. And then there's another question here that says, will all the very frightening info on social about the risks and dangers of these vaccines, with all the very frightening info, why would there be so much skepticism and concern if it can be considered safe? That is, what do the anti-vaxxers know? I think, what I've been following most of what's on the social media. And what has been quite interesting is how they take scientific concepts, and the scientific concepts are twisted to drive a specific point. And for people who are lay, who may not have a full understanding and appreciation of some of these scientific concepts, it's easy to believe the information the way it's packaged. And I think, vaccine hesitancy and vaccine skepticism, it's not a new concept. It has been there for decades, and in fact, maybe over centuries, where people have always doubted some of these interventions. But the difference in 2021 is the role of social media in actually, disseminating some of this information at a very fast pace. And really, it's really that, but it's also about how they take, and also they are playing on people's, doubts. It's like, I always think about how people get, robbed of their monies by scammers. Scammers know human behavior, and they work on human behavior to actually drive, some of their scams. Similarly here, people are working using understanding the human behavior, that if we twist it like this and make it more as if it's authentic, then people are going to believe it. So it's really about which source of information you rely on. If you're relying on social media, then it becomes a bit tricky. And then, but what about, but what about when the info is supposedly from experts in their fields? And so remember, there are people who are experts in cardiology, but they're not vaccinologists. There are people who are experts in other fields of medicine, but they're not epidemiologists. So I think it's also very important to understand, where is this information coming from? Is it coming from vaccine experts? Is it coming from epidemiologists who are public health experts? Because we must also just appreciate that not everyone is an expert in vaccinology. So I think that's important. And someone is saying that the vaccine was designed for the initial virus. In countries such as Israel, there are cases of variants amongst vaccinated. Those that have had COVID in the past don't seem to be affected. So I think it's important, yes, the vaccines were developed against the wild type variant, but if you think about the wild type virus, but we also understand that, with the variants, even in areas like Israel, even in areas, I've referenced some of the other countries like the US, the UK, we've still seen the maintenance of efficacy against severe illness and disease. Severe illness and death. Even though people can still get infected, most of those people who are vaccinated still have mild illness, and they're not dying. If they are dying, it's very few numbers, and also they are not getting as hospitalized as those who are not vaccinated. So I think that's very important. One of my, I was unable is, so I think this will be recorded and it could be watched later. How long after COVID may I get vaccinated? So this is an important question. If you are taking, so if you want to be vaccinated, we speak about recovery, post-recovery. So you have your COVID, you recover, and then 30 days after recovery, then you can get vaccinated. So people have asked me, so what does recovery mean? So I've tried to simplify it by saying, if you have a positive test result and you are asymptomatic, so, we talk about 10 days of isolation. So once you get out of isolation, count 30 days and then you can vaccinate after 30 days. Similarly, if you had your symptomatic COVID, so from the day of your onset of symptoms, if you are not hospitalized, after you de-isolate in 10 days later, then you can vaccinate 30 days later. Similarly, for those who are admitted to hospital, remember, we say you only start your 10 days post of recovery after you stop, if you were on oxygen, after you have no longer, after you've stopped oxygen therapy, then after that 10 days, you add 30 days and then you can get vaccinated. So we talk about 30 days post COVID recovery. So it will depend, because remember, our recovery will depend on the severity of your illness, which is why I've given you that guide. And then should I take Allergex with me in case of an allergic reaction? Not necessarily, because at the vaccination site, they will have all the kits that are required for managing an allergic reaction. There are some people who have got, what we call the COVID arm. They get an itch around the vaccination site. It feels warm, it feels red. And we do recommend you can take your Allergex at home to manage the itch, and you can take paracetamol to manage that. Similarly, if you've got other people who have got aches and pains, headaches, you can use paracetamol to manage those. Please advise if it is recommended to isolate for 14 days after the first dose of the vaccine. So after vaccination, there's no requirement for isolation. So it's important, not unless you've been exposed and you think you may be infected and you are not fully vaccinated, then your quarantine period is related to the exposure, but not to the vaccine itself. I've experienced extreme fatigue post-vaccination. How long will this pass? So it should not be longer than 3 days at Tricia. So I'm hoping that you vaccinated recently and that the fatigue should eventually go off. I had COVID 3 months ago and I'm still battling with smell and taste. This is really what I was referring to around long COVID. And there are some techniques in terms of what we call, it's almost like training your sense of smell to come back again, which is what we call olfactory training. So it's important, maybe if you are experiencing that, maybe to talk to your ENT specialist to try and guide you in terms of how you can train your sense of smell to come back. What happens if you have the vaccination and you didn't know you were in early stages of pregnancy? There is no issue at all. Most of the recommendations actually are not to wait for the first 3 months because of the severity of COVID-19 in pregnant women. Most international guidance is really to just vaccinate all pregnant women regardless of gestation. The recommendation to wait after 3 months is really because we rarely introduce medications in the first trimester, because that's your early developmental stages. But usually with some of the vaccines, I mean, we've been recommending even influenza vaccinations as early as once a person has tested positive, their pregnancy test has come back positive. Will it become compulsory for everyone in SA to be vaccinated? It may be. I think for me, where we're going to start seeing some of these mandatory vaccination policies is in the workplace. So people should be aware that this may be coming. Can I take Panadol before the vaccine to reduce the side effects? I think instead of taking it before, I would say, immediately after, if you want to manage, you can just take paracetamol, after you have had your dose. I'm 37 weeks pregnant. Should I wait to give birth? No, you must get vaccinated. Actually, we prefer that by the time you get to your 3rd trimester, you are already fully vaccinated, because the risk of severe illness and death is in the 3rd trimester. So if you can still vaccinate now, it's better. And remember, there is no requirement for you to stop breastfeeding. You can continue to safely breastfeed even after you have, delivered. Early data actually showed that pregnant women who got the vaccine during pregnancy had antibodies that were transferred to their babies, which offers protection for their babies as well. Is the vaccine approved by the FDA? Okay, yesterday we got good news. Pfizer is fully approved by the FDA, but vaccination, COVID vaccines up until now, they were only, approved under the emergency use authorization because obviously we're in a pandemic, so it's a public health emergency. Can you take Disprin a week before? No. So there's no requirement for you to take Disprin to reduce blood clots. I've had COVID and still suffer with breathing problems, which can definitely part of what I spoke about. We know that there are people with these persisting symptoms. So what I would encourage you to do, I don't know if you were seen by a physiotherapist at the time when you had COVID, it would be nice, to get to maybe 1 session or 2 with a physiotherapist. They will teach you some breathing, exercises to try and improve, COVID, the long COVID symptoms. When receiving the vaccine, while pregnant, can you get it at any time during your pregnancy? Like I said, in South Africa, it is advised that you have at least completed your 14 weeks of pregnancy before you can get, the vaccine. Do we need to get another vaccine when the 4th variant hits us? I would rather we prevent the 4th variant, because remember, variants emerge as long as the virus still continues to, to be spread. Because remember, what are variants? It's really remember, viruses, multiply in our bodies. And when they multiply, they make copies of themselves and they make mistakes along the way. And these are the mistakes then that produce new variants, which are so it's mistakes that are significant enough to make this look different to the parent virus. So if we prevent the continued spread of the virus, then we can actually minimize the emergence of variants. When you mentioned severe allergic reactions, are there any types of allergies that you would make? So this is very important. This is a very important question. So if you are a person who has penicillin allergies or other drug allergies, it's not a contraindication. So meaning it's not really a risk for you to take the vaccine. But we worry about people who have had allergic reactions to other vaccines. So those are the people that, we monitor very carefully. But in general, anyone who comes to a vaccine site and says, I've had allergies, they will be monitored for at least 30 minutes. But other, allergies to other, medications are not really as worrisome as a person who has had a vaccine allergy. And also there are specific components of the vaccine itself that if you have specific allergies to those components, we need to know about that so that we can decide on whether we can give you a different vaccine to the one that you may have an allergy to. How is it that someone got vaccinated with Pfizer and gets sick for 2 weeks after? Exactly. So remember, you only get fully vaccinated with Pfizer after 2 weeks of your second dose. So if you got your first dose and you got sick after 2 weeks, you are not fully vaccinated. So I think that's important to just clarify. Do you choose a vaccine of your choice or give whatever they have? Currently, you get whatever is offered. But like I'm saying, if you've got a specific allergy to one component of the vaccine, then for those instances, you may be considered for another vaccine. How long do you need to wait to get the vaccine? So we've spoken about that. Disadvantages of getting vaccine if you have comorbidities. There are more advantages for people with comorbidities because remember, these are the people who are most likely to have severe COVID and who are most likely to be admitted and most likely to die. There are no head-to-head studies. So you cannot say J&J is better than Pfizer or Pfizer is better than J&J because there are no head-to-head studies for these vaccines. So if we think about vaccines that have been approved, that are available right now, they are all equally good against preventing severe illness and death. Have been assisted, but how can we determine fast track long term? So I mean, we're not so because the vaccines have not been with us for long enough, we don't have long-term safety data. But if you think about how vaccines work, the fact that you stimulate the immune system now and the side effects are usually within this period of time, it means that long-term side effects are really unlikely if we understand how vaccines work.
Sorry, Doc.
Yes, okay, we've got 3 more minutes to go.
I see we're running. Can I just make a suggestion? I don't know time-wise, I know we had said, and it's been very interesting what you've been saying, and we've got a lot of questions. We are definitely recording and we will distribute this out to everybody. Do you want to, can I maybe possibly suggest that we address all the questions? There might be repeat questions, and then what we will do, guys, is we will email it out to all of you with the ongoing questions, because I think obviously we're running out of time for the schedule, which has been so we can definitely guarantee that we will get all your questions answered. If there are any more questions, guys, that anybody got questions, you've got the link from us. You can reply to us. We will, as I said, we will send out the link of the presentation with the Q&A attached to it. And we'll also, obviously, we'll forward it to HR because I know a lot of people are unable to attend, and we'll send it out to individuals as well. So
thank you so much, Derek. And also, I think people can also visit our website. We've got a COVID content hub there. We've got a lot of content that addresses some of the questions. So thank you so much. Okay.
Well, thanks. Dr. Noto, thank you so much. That was really very interesting. And I think you've answered a lot of questions, and we'll continue. Thando, for all your assistance, for all of those that have dialed in for listening, thank you so much. Note that we will, as I said, we will send the information on to you shortly. During these strange times, our offices are still open, but if they happen to be temporarily closed for whatever reason, you can get hold of us through through email, or our phone line is still transferred, and we are doing most of our consultations online at this stage. And we will continue until keeping you updated with everything. But once again, Dr. Noto, that really was really very, very helpful. And we thank you so much. And thank you, everybody, for attending. We will send out the information and the answer to questions shortly. Thank you, guys. Thank you so much. Thank you.